Welcome. Today we will be talking about alignment and pressure reducing device application. Equipments needed: wedge pillow, leg support or abduction pillow. If you're using a device that's available in different sizes, select the appropriate size for the patient. Inspect all equipment and supplies. If a product is expired or defective or has compromised integrity, remove it from patient use. Label it as expired or defective and report the expiration or defect as directed by your facility. Gather and prepare the necessary equipment and supplies. Perform hand hygiene. Wear PPE as needed. Provide patient privacy. Confirm the patient's identity using at least 2 patient identifiers. Explain the purpose of the alignment and pressure-reducing device to the patient and family if appropriate, according to their individual communication and learning needs to increase their understanding, allay their fears, and enhance cooperation. Assess the patient's skin, paying special attention to the area where you'll apply the device. Note and record any areas of redness or swelling and pay close attention to pressure points at the elbows, heels, trochanters, sacrum, coccyx, buttocks, and ischium, as well as beneath the medical device because these areas are more prone to pressure injuries. Using proper patient handling techniques and good ergonomic principles, have your patient turn as far over as possible on the side. Tilt the angle slightly so you can place the top part of the cushion under the scapula. Notice how the wedge will support the buttocks area. Notice that the wedge has no direct contact with the sacrum. For side sleepers that need a little hip support, you can place the cushion between the legs. Now notice here too that you actually even get some float from some of the bony prominences. Even the ankle is floated gently across the top of the skin-friendly surface that is providing even pressure distribution. For taller people where the feet keep pushing against the rail, you can use the wedge as a protective cushion, and if you have patients who have wounds on their feet or toes and require protection from the bed sheets, you can use the wedge as a bed skirt so that there's no direct contact with the feet. You can also use it to elevate upper extremities. In applying an abduction pillow, slide the abduction pillow between the patient's legs. In applying a heel suspension foam cushion, place the patient in supine position. Slide the foam cushion longitudinally under the patient's calves, avoiding the Achilles tendon. Make sure that the patient's heels are suspended in the air. Ensure that the patient's knees are flexed slightly to avoid popliteal vein compression and the risk of deep vein thrombosis.